Hello everyone. The next developmental disturbances of oral and paraoral structures is oral lymphoid tissue. In the developmental disturbances of oral lymphoid tissue, these are some lesions like reactive lymphoid aggregate, lymphoid hamartoma, angiolymphoid hyperplasia with eosinophilia, and lymphoepithelial cyst. In this video, I will discuss about reactive lymphoid aggregate and lymphoid hamartoma. First is reactive lymphoid aggregate, which is also known as reactive lymphoid hyperplasia. The lingual tonsil, one of the largest oral lymphoid aggregate, is located on the posterior portion of the tongue on the dorsolateral aspect. It is typically surrounded by a crypt which is lined by stratified squamous epithelium. It frequently becomes inflamed. The tonsil frequently becomes inflamed and enlarged so that it is clinically evident. Such enlargement is usually bilateral. Okay? Generally it is bilateral. If in any case it is unilateral, it may easily be mistaken clinically for any carcinoma. This reactive lingual tonsil has often called foliate papillitis, referring to the vestigial foliate papilla in this area. The foliate papilla is inflamed. Similar reactive hyperplasia may occur in the other locations, like most commonly on the buccal mucosa. Clinically, it presents as a firm nodular submucosal mass which may be tender. Generally, there is a swelling that is referred to as firm and nodular swelling. Since this lymphoid tissue may be the site for the development of lesions of the malignant lymphoma group, so there should be early microscopic diagnosis is essential whenever the lesions do not regress in a short period of time. अगर ये swelling generally कम time पे reduce नहीं होता है, then it should be go for a biopsy. Hyperplastic lymphoid polyps have also been described as polypoid structure composed entirely of lymphoid tissue. Okay, they are reported to occur on the gingiva, buccal mucosa, tongue, and floor of the mouth. Next type is lymphoid hamartoma. Is otherwise known as Castleman tumor, angiofollicular lymph node hyperplasia, angiomatous lymphoid, hamartoma of lymphatics, giant lymph node hyperplasia. So hamartoma is a benign local malformation of cells that resembles a neoplasm of local tissue, but usually due to overgrowth of lymph node. Okay, so that is the hamartoma, which is a rare disorder characterized by non-cancerous benign growths. Okay, this is lymphoid hamartoma. Then it most commonly occurs in the chest, stomach or neck, that is localized disease of hyaline vascular type. Less common sites include armpit, that is axilla, pelvis and pancreas. Usually the growth represents abnormal enlargement of the lymph nodes normally found in these areas, that is lymphoid hamartoma. There are two main types of lymphoid hamartoma or Castleman disease. First is hyaline vascular type. Second one is plasma cell type. The hyaline vascular type, approximately 90% of the cases showing hyaline variant. Most individuals exhibit no symptoms of this form of the disorder, that is asymptomatic, or they may develop non-cancerous growths in the lymph nodes. The second variant is plasma cell type, is associated with fever, weight loss, skin rash, early destruction of RBC, that is low levels of circulating RBCs, which is known as hemolytic anemia, abnormally increased amounts of certain immune factors in the blood, which is known as hypergammaglobulinemia. A third type of Castleman's disease has been reported in the medical literature. This type may affect more than one area of the body, that is multicentric or generalized Castleman disease. Many individuals with generalized Castleman disease may exhibit an abnormally large liver and spleen, that is hepatosplenomegaly. The etiology or the causative factor for lymphatic hamartoma or Castleman disease is the exact cause is not known. Some researchers speculate that increased production of interleukin 6 may be involved in the development of Castleman disease. Interleukin 6, that is IL-6, is a substance which is produced by structure within the lymph node. So these are all about the developmental disturbances of oral lymphoid tissue, that is your lymphoid hyperplasia and lymphoid hamartoma. I hope you like this video. Thank you so much.